Sometimes your body whispers warnings long before it shouts. One of those whispers is itching, a sensation most people dismiss as dry skin or an allergy. But what if that persistent itch is actually your liver, your kidneys, or even your blood trying to tell you something urgent? Today I want to share 3 serious conditions that often begin with itching, and why recognizing this early sign could save your health or even your life. Itching seems harmless at first. You scratch, you move on. But when itching becomes constant, spreads across your body, or worsens at night without any visible rash, your body may be signaling an internal problem. In my years of clinical practice, I've seen patients ignore itching for months, only to discover a serious underlying condition later. The good news is that when you understand what your body is saying, you can act early and prevent complications. Here's the part most people miss. Not all itching comes from the skin. Let me start with the liver. Your liver is one of the most hardworking organs in your body. It filters toxins, produces bile, stores energy, and regulates countless metabolic processes. When the liver becomes diseased, whether from fatty liver, hepatitis, bile duct blockage, or cirrhosis, bile salts can build up in your bloodstream. These bile salts deposit under your skin and trigger intense itching. This type of itching is called cholestatic pruritus. It often appears on the palms, soles, and torso. It worsens at night and is not relieved by scratching. Many people describe it as unbearable. In Japan, where regular health checkups are part of the culture, liver enzyme tests are commonly included in annual screenings. A simple blood test can detect elevated bilirubin, alkaline phosphatase, or liver enzymes, all of which suggest bile flow problems. If you experience unexplained itching along with yellowing of the eyes or skin, dark urine, or pale stools, these are red flags. Do not wait. Early detection of liver dysfunction allows for treatment before irreversible damage occurs. Fatty liver disease, which is increasingly common worldwide, often progresses silently. Itching can be one of the few noticeable signs in the early stages. Now let me explain the second dangerous condition, chronic kidney disease. Your kidneys filter waste from your blood, balance fluids, and regulate minerals like calcium and phosphorus. When kidney function declines, waste products and toxins accumulate in your bloodstream. This buildup, especially of urea and phosphates, can cause severe itching. Doctors call this uremic pruritus. It typically affects the back, chest, and limbs. Unlike liver-related itching, kidney-related itching tends to be generalized and may worsen after dialysis in advanced cases. But the real issue is that kidney disease is often silent in its early stages. You may feel fine, have no pain, and still have declining kidney function. Here's where lifestyle habits matter deeply. In Japanese health culture, there is a strong emphasis on preventing disease rather than only treating it. Simple habits like drinking water consistently throughout the day, walking regularly, and monitoring blood pressure can protect your kidneys. After age 40, kidney function naturally begins to decline slightly each year. If you add high salt intake, uncontrolled diabetes, or frequent use of painkillers, that decline accelerates. If you have persistent itching and also notice swelling in your legs, fatigue, poor appetite, or changes in urination, ask your doctor to check your creatinine and estimated glomerular filtration rate. These tests reveal how well your kidneys are working. Early intervention can slow or even halt the progression of kidney disease. Stay with me for this next detail, because the third condition is one many people never consider. The third dangerous disease that starts with itching is a group of blood disorders, most notably polycythemia vera and certain types of lymphoma. Polycythemia vera is a rare blood cancer where your bone marrow produces too many red blood cells. This thickens your blood and slows circulation. One of the earliest and most characteristic symptoms is itching, especially after a warm bath or shower. The itching is caused by the release of histamine and other chemicals from excess blood cells. Patients often describe it as prickling or burning. Lymphomas, which are cancers of the lymphatic system, can also cause persistent itching. This happens because the immune system releases inflammatory chemicals as it reacts to abnormal cells. The itching is often widespread and not linked to any visible skin problem. It may be accompanied by night sweats, unexplained weight loss, or swollen lymph nodes. These are warning signs that should never be ignored. In both cases, early diagnosis through blood tests and imaging can lead to treatment before the disease advances. Here's something important to understand. Itching from internal disease feels different from regular skin itching. It is deep, persistent, and not relieved by moisturizers or antihistamines. It often disrupts sleep. If you have been scratching for weeks without relief and your skin looks normal, do not assume it is just dryness. This is your body's way of telling you to investigate further. Let me pause here for a moment. If you're finding this information helpful, please take a second to like this video and subscribe to the channel. Your support helps us reach more people with evidence-based health content. And if you know someone who has been struggling with unexplained itching, share this video with them. It might be the wake-up call they need. Now, let's talk about what you can do. First, pay attention to patterns. Does your itching worsen at night? Does it happen after bathing? Is it localized or all over your body? Are there other symptoms like fatigue, weight loss, yellowing skin, swelling, or changes in urine color? Write these details down. They will help your doctor make an accurate diagnosis. Second, do not self-diagnose or rely only on over-the-counter creams. If itching persists for more than 2 weeks without improvement, see a healthcare professional. A basic evaluation includes a physical exam, blood test to check liver and kidney function, complete blood count, and sometimes imaging or biopsy if needed. These tests are not invasive and can reveal the root cause quickly. Third, adopt habits that support your liver and kidneys. In Japanese daily life, small consistent actions are valued over dramatic changes. Drink water regularly throughout the day, not just when you feel thirsty. Walk after meals, even for 10 or 15 minutes. This helps regulate blood sugar and support circulation. Limit processed foods high in hidden sodium and unhealthy fats. Choose whole grains, vegetables, fish, and fermented foods when possible. Green tea, a staple in Japan, contains antioxidants that support liver health, though it is not a treatment by itself. Pay attention to your sleep routine. Going to bed and waking up at consistent times supports your body's natural repair processes. A warm bath before bed, a common practice in Japan, can help you relax and may temporarily soothe itching by improving circulation and reducing stress. However, if your itching worsens with heat, avoid very hot baths and let your doctor know. Be mindful of medications and supplements. Some over-the-counter painkillers, when used frequently, can stress your liver and kidneys. High doses of certain vitamins, especially fat-soluble ones like vitamin A and D, can accumulate and cause toxicity. Always inform your doctor about everything you take, including herbal products. Natural does not always mean safe. If you have risk factors such as diabetes, high blood pressure, obesity, or a family history of liver or kidney disease, regular checkups become even more important. In Japan, annual health screenings are standard, and this preventive approach has contributed to early detection of many conditions. Even if you feel perfectly healthy, a yearly blood test after age 40 can catch problems before they cause symptoms. This content is for general educational purposes. If symptoms are severe, persistent, or concerning, consult a qualified clinician. If you notice sudden swelling, difficulty breathing, severe abdominal pain, or confusion along with itching, seek urgent medical care immediately. Let me summarize the key points. Persistent itching without a clear skin cause may signal liver disease, chronic kidney disease, or blood disorders. Each of these conditions has specific patterns and accompanying symptoms. Early recognition and medical evaluation can prevent serious complications. Simple lifestyle habits like consistent hydration, regular movement, mindful eating, and routine checkups support your liver and kidneys. Do not ignore your body's signals. A small itch today could be a loud alarm tomorrow. Now I have a question for you. Have you ever experienced unexplained itching that lasted more than a week? If so, what did you do about it? Share your experience in the comments below. Your story might help someone else recognize their own warning signs. Thank you for watching, and I'll see you in the next video. Stay healthy and stay aware.